EMS responders need to understand the variations in capnography waveforms, both normal and abnormal. Because most responders do not use capnography on a frequent basis, they may be limited in their understanding of abnormal readings.
There are a lot of things that can change that waveform. Some things aren't a big deal, other things are. In order to understand what abnormal is, we first must know what normal.
The normal waveform should be square or box-like in appearance. The normal range of CO2 in exhaled air is 35 to 45 millimeters of mercury. The respiratory rate would be within normal limits. Abnormal waveforms will display a gradual increase in end-tidal carbon dioxide, which appears as the rising peak at phase 3 of each wave. These abnormal waveforms are associated with rising body temperature, hypoventilation, and increased metabolism. Common abnormal waveforms EMS responders will encounter include hypoventilation, hyperventilation, and bronchoconstriction. Typically, the hypoventilation waveform appears square like a normal waveform, only with prolonged exhalation. The range is greater than 45 millimeters of mercury. Hypoventilation can also have a very small waveform in shape and value if the patient is not producing adequate tidal volume for the monitor to read. The hyperventilation waveform is typically square in appearance with a shortened exhalation phase. The numeric value is less than 35 millimeters of mercury. The characteristic waveform pattern for bronchoconstriction is a shark fin shape. When bronchospasm hampers ventilation, there is a curved upstroke of phase 2 with a more pronounced angle to phase 3. Again, there is a prolonged exhalation phase.